All right. Thank you all so much for coming. It's nice to see faculty and staff and students and friends and colleagues for this wonderful event to celebrate Dr. Bezruchka's new book, Born Sick in the USA. We are so happy to have you. Dr. Bezruchka has had a long, storied career. In fact, I think it includes about 5 careers, the most recent of which is as professor in health systems and population health at our own School of Public Health, Professor Emeritus, and beloved teacher. And we are so happy to have you here in your role as beloved author. So our run of show today is that Dr. Bezruchka will give some comments for about 15 minutes, and then we'll do a Q&A asking the audience to participate in that. And he told me beforehand he wants hard-hitting questions. He wants you to challenge him. That is not how I roll, so I will not be challenging him, but that's your challenge. Okay.
Good. Well, thank you very much, Dr. Megha Ramaswamy. So I'm here to talk to you in this room and everybody out in virtual land there. And the best way to learn something, think back to your childhood. The way we learned something was through stories and fairy tales. Think of Snow White and the 7 Dwarfs and Goldilocks and the 3 Bears. Most of the stories have a protagonist or a hero, an antagonist or villain, some inciting action to put the characters into motion, and then a challenge to overcome, and finally resolution. So instead of my story today being about individuals, I want to make the story about countries, which our fairy tales and stories almost never are. So to begin with, I want to ask you a question. What is the most common sexually transmitted infection?
HPV.
Let me give you a hint. Everybody here has this infection. I saw something.
You.
So what is it? Life. You're all here because your father's sperm infected your mother's ovum to produce a zygote, and here you are. And I wonder if the life of modern people isn't something like this. So the Olympics were held in Italy, and they were concluded with Norway winning the most medals. Number 2 country was the United States in terms of medals. Since the games began in 1896, we've won the most medals overall. So we really do well. In the summer games, we usually clean up. Suppose health were an Olympic event, and the race was how long people in the country live, life expectancy. So I'm going to ask you, how would the United States do in this race? I'm going to, so here are the games. How many would give us the gold medal? In 2024, we spent 18% of our economy, $5.3 trillion on healthcare. It's about $15,500 per person. And that represents almost half of all the money spent worldwide on healthcare. How many would give us the gold medal? Top 5. 6 to 10. 1. 11 to 15. 1. 16 to 20. 1. 2. 3. 21 to 25. 1. Anybody put us below 30? Okay, so here's the running for the 2022 Health Olympics. I've been doing this for 25 years now, using the same source, the UN Human Development Report, and this is taken from the report in 2024, and it's the top 45 countries ranked by life expectancy in 2022, Table 1 of the Human Development Report. So what do we see here? Typically, I ask my students to describe the graph. The vertical axis is life expectancy years. The horizontal axis is 45 of countries at the top of the list. So we are down there in the red at 78.3 years, tied with Cuba. So we have the same length of life as Cuba does. What have we been doing to Cuba over the last 64 years? Strangling it. We're even talking about taking it over. Are we putting the noose around our own necks too? Maybe something's going on. Now, the numbers, life expectancy numbers, keep increasing. And they've been increasing since we started tracking these, with the exception of a few calamities since 1933 in the United States. So we're about 7 years behind the longest lived country, Japan. What does that translate into? Is that just another few more years drooling in a nursing home? Maybe it's just not significant. What's our leading disease killer? Heart disease, she's patting her. What's number 2? Cancer. What's number 3 in 2022? Unintentional injuries. It was COVID the year before, but in 2022, unintentional injuries. Suppose we eradicated our 3 leading killers, if conditions that will kill half of the almost 3 million deaths in 2022. How many life expectancy years would we gain? About 7. So if we eradicated our 3 leading disease killers, then we would be pretty close to one of the healthiest countries in the world. So that suggests the gap is substantial. That's the point I'm trying to make there. So why? Why are we, one other point to make. In the early 1950s, we were way over there on the left-hand side, somewhere in the top 5 or 10, depending on the year. The numbers were lower, so other countries experienced faster or more substantial gains in length of life than we have. So the question comes up to why. Well, first of all, healthcare can't be an important part of this because we spend half of the world's healthcare bill, and we think we have the best healthcare system in the world, or we used to. So healthcare can't be a very big part of this process. What else might explain it? Any thoughts? I'm hard of hearing, so shut it up. Okay, you're kind of stumped. What do you do to be healthy? Eat right, exercise, don't smoke, right? The usual stuff. So let's take a personal behavior that probably not many in this room do. Cigarette smoking. Anybody admit to smoking here? Okay. So out of all these countries on this list, which countries have the lowest proportion of men smoking cigarettes? United States and Sweden. Which countries on this list have the highest proportion of men smoking? Japan and China. About 45% of men smoke in Japan, similar number in China, 3 times as many smokers in the longest lived country than in the United States. So if I told you that was the reason Japan is so healthy, namely that all men smoke, you'd be wise to not believe anything else I say. But I point that out because a behavior that we consider bad for health, they do a lot of in Japan, and yet they live much longer than we do. So what explains all of this? That's really tough. So we have to explore other factors other than personal behaviors and health care. And so that's the point of what I'm talking about today with Born Sick. So in our characters, United States is the protagonist. The bad guy we're going to learn is our economic inequality. The inciting action is to overcome our inequality. And Americans are resistant to not giving everything to the rich, and I'll go into that. And if we can resolve that, we'll live a long, healthy life forever after. That's the challenge. So because we live in this country, none of us as individuals can claim to be the healthiest people on the planet. You know, lots of people write books on how to increase your longevity and everything else. They're all relatively young people. The oldest old person at any one time is never in this country. And the healthiest person, however you want to characterize health, is similarly not in this country. So we live shorter, sicker lives than people in over 40 other countries, and the rich, by and large, richer are healthier than poorer, but the rich in this country are much less healthy than considerably less rich people in other countries. Notice along the, it's hard to read for you, but Chile, China, Estonia, Slovenia, Qatar, you know, a lot of countries that we wouldn't consider rich paragons of health live longer lives than we do. You also have to believe that these data are true, that they're valid. You know, I worked as an emergency physician for 30 years, and the easiest diagnosis I could make in the ER was that somebody was dead. It's hard to fake. Then I fill out a death certificate that's merged with the birth certificate, and so we can calculate mortality rates and come up with these numbers. Just like find slightly different numbers depending on whether it's the World Health Organization or the World Bank, but none of them show the United States any better than in this. I use the UN data because, for example, there are non-UN countries such as Taiwan that has longer lives than we do. So I want to present us in the best possible light. Our healthiest state, our longest lived state is Hawaii, has been for a number of years. The Department of Health in Hawaii produced a report in 2011 on social determinants, and the graphic you see there on the left was on page 2 of the report. And they distinguish Makai to the water downstream effects with Mauka to the sky upstream effects. So this is what the Department of Health in Hawaii thinks is really important. And so I want to explore this mountainside metaphor. So let's look downstream. You know, here are the diseases I have, you'll have as you get older. They're in the water there. What's on the shore above that? Risk factors. Smoking, physical inactivity, obesity. Notice Hawaii situates these far downstream, just as I'm trying to get you to believe. What do they put on the other side of the river? Healthcare. Again, something about Hawaii, they recognize healthcare isn't that important in the process. So let's go upstream to the waterfall. And this is what we now call the social determinants of health: discrimination, racism, community context, deprivation, crime, safety, housing, geography, place, poverty, education, employment, occupations, risk markers, income, and wealth. Really big stuff that public health is now recognized as really important, but Hawaii doesn't stop there. So let's go upstream. Socioeconomic conditions, and then the top is political context and governance. That's an academic way of saying politics. So to Hawaii, the Department of Health, politics seems to be the most upstream or important factor in producing health. So what do Americans think? There was a study from Boston University School of Public Health ranking 10 factors in terms of most important for health and least important among 8 countries. And this is what Americans ranked. Number 1 was healthcare. Politics was last. So the public, and I think this is, I'd be interested in your thoughts, think that politics seems to matter least for producing health. Well, we can look at a variety of, so something is not computing right among the American public. I must say all the other 7 countries also rank politics last. Only one ranked healthcare number 3, and that was China. They put income and wealth and education higher than healthcare. So most of the world thinks it's healthcare that really produces health. And our language makes it difficult to disentangle these, right? You say you get health, access health, pay for health, insure health. Well, those all mean healthcare. So our language conflates the terms health and healthcare and makes it harder to distinguish the difference. You ask somebody, do you want health or healthcare? They're confused. Both the terms mean the same thing. That's our challenge. Well, we can look within the United States and look at health outcomes at the U.S. county level. So there's a map on for 2019 in the book on page whatever I've forgotten. But this is a year later where red is the lowest life expectancy and dark blue is the highest life expectancy. You can see Hawaii is all blue. And where's the red? Well, in Mississippi Valley, Appalachia, the Southeast. And then there's places that are even deeper red, such as in South Dakota Pine Ridge Indian Reservation in Oglala, Lakota County. Notice at the top left, there's a 20-year difference in life expectancy among U.S. counties. That's huge. Remember, 7 years was our 3 leading killers, eliminating them. So it's very hard to characterize a 20-year gap from the Indian Reservation to 200 miles away in Summit County, Colorado, is the longest lived county. That's where Aspen is. That's where all the billionaires live and meet every year. So in such a short space, you have such a big difference in health outcome. So what's really going on here? I mentioned that, well, the title of my book says Born Sick in the USA. By the time you're born, a large part of your health as an adult has been programmed. And so one of my COPHP students coined this phrase, early life lasts a lifetime. And what this is saying is, remember you started life as a zygote with the sexually transmitted infection that I tried to get you to believe. My wife is shaking her head. She hates that analogy. We now recognize that in the first 1,000 days after conception, by the time you're blowing out 2 candles on your 2nd birthday, about half of your health as an adult has been programmed. So healthier countries privilege that period in a variety of different ways. So the first 9 months, you're in your mother's womb. And what is going on during that period? Well, your mother is, in the United States, we are one of the most stressed countries in the world. And so your mother is feeling this stress, and she's transmitting stress hormones to the fetus through the placenta. And this causes the fetus to say, boy, it's really a tough world out there. I may have to mature my organs quickly and pop out soon to do what I'm here to do, which is to reproduce. Remember, if we don't reproduce, our species dies out. So we're programmed to survive, to reproduce, and pay the price later with all the chronic diseases we face. That's the room with the view perspective. Lots of evidence for that, just not much awareness in the United States, but the healthier countries are aware of this. So let's take a few other countries. This is Norway, Sweden, United Kingdom, and United States, and how much money the public spends through the early years. And Norway, you can see the dark blue, they put all the expenditure, most of the government expenditure in the first year of life. Notice that's $45,000. On the lower right, the United States, only $16,000. And we spend our money in the teenage years for remedial action that we didn't do when it really mattered. So that's a critical point of view. There's only you've got to have policies that privilege early life. There's only 2 countries in the world that don't give a working woman who's pregnant paid time off after she has her baby as a national policy. One is, of course, the United States, and the other is Papua New Guinea, half of a big island north of Australia. So, we're stuck in the starting block. We're not going to do well there. So I like to use this roller coaster life cycle model of health. You start in diapers, Disneyland, rock and roll, masturbation, sex, marriage, career. You're all in the upswing, right? I've had my colonoscopy. They're threatening to retire me. You can tell I'm drooling and confused, and I'll be back in diapers soon. It's before you go to Disneyland that's the critical period that we have to do something about making sure that we're around to go into diapers the second time. And we neglect that period big time. Well, the book I've used as a textbook in my undergraduate course I've taught for many years is The Spirit Level, which looks at inequality, income inequality on the x-axis, and an index of, for those of you who know what a z-score is, z-scores of all of these social and health problems. And when you plot them for the 23 richest countries, what do you see? There's Japan down there, low inequality, good outcomes for all of these, and we're the outlier on the upper right. So these are data from 2009. Last year they did a retrospective, and I could present the graph from that, but things are even worse. Why are they worse? Well, from 1975 to 2023, we, the bottom 90%, I assume most of you are in the bottom 90%, took $79 trillion out of our wallets and gave it to the richest 1%. How much is that? It's hard for us to fathom large numbers. Well, if you took our largest currency is a $100 bill. If you took a stack of freshly minted $100 bills and stacked them up tight to reach 79 trillion, how far would they go? Quarter of the way to the moon. So that's how much we have done we've given up to the rich, and that's killing us. Another graph in my book looks, again in my story about countries, at 5 countries. Once you get too many countries, it's too confusing. So this is a graph of 5 countries, Sweden, France, Germany, Britain, and United States, and how much the government commanded in tax revenue from the people from 1870 to 2015. So back in the 1800s, it was around 8 or 9%. That's how much the government took in taxation from the public. Well, that's enough to pay for a palace for the king or the ruler, standing army to protect his private property, and so on. And then about 1900, countries began taking more tax from the people, and they plateaued around to 1980 or so, and the United States sort of plateaued at 30%, and Sweden went up to 54, 55%. So Swedes pay a lot of tax, and they don't begrudge it because they get a lot in return. Free healthcare, free education at all levels, paid family leave out to 2 years, free daycare, so it works out really well for the Swedes. What does our 30% go for? Well, right now it goes for our huge military, $1 trillion there, soon to go up to $1.5 trillion sometime in this coming year. They tax cuts for the rich, subsidies for the rich, and Medicare, and which kicks in at age 65. Older. And And so spending money on Medicare really is the wrong time if you want to improve health. So we have to conceptualize these terms, equality and equity. So somebody got this license plate on their car. Equality means everybody has the same advantage or disadvantage. Equity means a fairness component to it. It's not fair if somebody has too much and somebody has too little. So this graph is in the book. Upper left, three people at a baseball game, all standing on the same box. That's equality. Take the box from the tall guy and put it under the shortstop. That's fair. That's equity. They all get the same view of the game. Lower left is, unfortunately, the situation in the United States. And liberation would imply that there was no fence and everybody had the same view. So what do we need to do? Well, in 1945, we firebombed Tokyo, dropped 2 atomic bombs on it, and destroyed the country. Japan's life expectancy at the end of the Second World War was 24 years. Then we occupied Japan. The world's greatest population health doctor, 5-star General Douglas MacArthur, and he put in place policies that made the most rapid decline in deaths ever seen, so that Japan became the longest lived country by 1978. So what were those policies? Well, he wrote the Constitution for Japan by cutting and pasting the equivalent of it from other constitutions. And Article 9 said, was a piece, said Japan shall never have an army. It has to resolve disputes peacefully. There was a demilitarization clause. Article 23 made the government responsible for the health of the people. He broke up the big corporations, the Zaibatsu, because in his memoirs, he said, they had too much power. We had to take it away from them. In 1946, he legislated a maximum wage, and that was a part of the process. And finally, Japan was a rice farming economy. 37,000 landowners owned the land that 50 million peasants farmed. He bought the land from the landowners, sold it to the peasants at the same price per hectare, gave them a very low interest 30-year loan to pay off the land, and 94% of the land in Japan changed hands. And historians call it the most successful land reform program in history. Well, so we put in place the policies to make Japan the richest, the healthiest country in the world. So we can either take our own medicine or ask Japan to give it to us. So if we do all this in our country story, namely take from the rich, support early life, do what we did to Japan in our story, we'll live happily and healthily ever after. I think that's enough time. So shall we sit up here and
Sure.
I can show a few more slides, but that's enough.
We do have one more slide.
Oh,
that
sorry. Okay.
Pop up on the screen.
Let me show the rest of these slides then. So Travis has helped me put together a website. The University of Washington now has a chapter of Washington Positions for Social Responsibility. This is our graphic. If you take a picture of the QR code, you can get on the list. And we're going to have a fundraiser, WPSR, in the fall. They've asked me to be the keynote speaker. And the previous book I wrote is Inequality Kills Us All, and you can download it for free, open source. I put bookmarks over there. I'm trying to make everything I produce as cheap or free as possible. And this is your slide.
just want to plug our next event, which is a talk on inequality, but this time in happiness. So please come to that if you're around. And thank you so much for those remarks, and for getting us inspired to think about inequality and health in this context. If you've not seen the book, I've got it right here, Born Sick in the USA. I have a signed copy that I'm willing to lend to any of you who need to borrow it, but it does have my name in it, so you have to return it. Okay, well, so one of my favorite concepts in this book is this idea of political medicine. What is political medicine, and what kind of dose do we need of it in this country?
Now I got this thing here.
Okay.
She wrote that in her blurb. I asked Dr. Megha Ramaswamy to write a testimonial. And so she put me on the spot with political medicine. If politics is the most important determinant of health, then what political changes do we want, or what dose? I mean, we should, for example, create a maximum wage in this country. In 1942, Franklin Delano Roosevelt, the president at that time, proposed a 100% tax on all incomes above $25,000. That's about $450,000 today. And most of us could live on that if we had to. So that would be one political, by the way, that didn't pass. A 94% tax passed. That's close to 100. And in 1946, it was raised to 96%. And in the 1950s, when we were one of the healthiest countries, our tax rates, the maximum tax rate was 91%. By the way, who today pays the lowest rate of tax on combined federal, state, and local income? Who pays the lowest rate of tax? Well, in 2018. Would you believe the richest 400 families? The richest 400, they pay the lowest rate of tax. Back in the 1970s and 60s, they paid the highest rate of tax. And we just decided we shouldn't have the rich pay tax. It's just not a good thing in this country. So that's one political medicine. With all the tax revenue we get, remember, our 30% is not helping us. We should spend it on early life. Those two things. We need Robin Hood. And once Robin Hood comes back from Sherwood Forest, we can spend the money on the early years. And, for example, in Sweden, it is mandatory to take 444 days of parental leave at your full pay. And the rest of the second year is optional at 70% pay. Then in your child's third year, you can put your child in a Swedish government-run daycare center that's free. And the requirement to work in a Swedish government-run daycare center is you have to have an advanced degree in play. Because what's daycare all about? It's socializing the kid. We need experts. So those two medicines at full doses.
Thank you. Perfect. You've long tried to educate us about the idea that though we spend the most money on healthcare, we have the worst health. Why isn't that a mainstream message, and how do we get that message out to the public?
Well, first of all, we have to separate health and healthcare. We need to, almost everybody talks about accessing health and getting health and so on. Once we make the disconnect, then we have to look at our very dysfunctional healthcare system. Yesterday, I gave a talk to the first-year medical students with my co-instructor, Paul Drain. And the students there's been a massive shift in the ideology of the students. I didn't yesterday, but in my class, I asked at some point, raise your hand if you call yourself a socialist. More than half the hand, I could ask you the same question here. More than half the hands in my students go up. 20, I started teaching 25 years ago. Nobody's hand would go up. You wouldn't admit you're a socialist. So what the medical students yesterday realized was that our medical care delivery system is profit care. And we have tremendous profits. A lot of them, what is happening is that practices and hospitals are being bought up. They're being run into the ground and closed. And that's profitable. I mean, think about it. It doesn't make sense. Studies show that if you get care in a for-profit institution, you're more likely to die than in a not-for-profit institution. Trouble is, we don't have many not-for-profit left. They're a dying breed, as are we. So take the profit out of healthcare. If we're spending 18% and the highest any other country spend is 10 or 11%, let's have the spending. At the federal government level, we already spend more per capita on healthcare than any other country that has universal healthcare. So we can afford it. We just have to change the for-profit system.
Stephen Wolf, your colleague, had an article that came out yesterday in JAMA, timely, about the disregard for population health as an official US policy. So plugging that you're bringing Stephen Wolf to campus in May. And also, we've got, I think, so many students in the audience. What should they be studying about this period in history with respect to the disregard for population health as a specific US policy?
Well, take my course. One of the parts, and I started doing this many years ago. I realized that just sitting in a class and learning that we're dead first isn't really all that helpful for the individual. So the students had to take the ideas in the class, pick a day and a place, and present those ideas to an audience that they invite there. And they're graded on how many people showed up. And I would go to these and sort of see what they were all about. Then COVID hit, and we couldn't ask them to set up a meeting anymore. So we said, go online, do social media stuff. And before, you know, if the student got 15 people, that was really a good outcome, and they got a good grade. With social media, they reach 1,000 or 2,000 or 3,000. So we have to get people, to know what the problem is and use all of the potential resources they have to get the word out. Now, there's something I talk about in the book that would be really helpful there are standardized tests. Remember, most of you took standardized tests in grade 3 to 8, so on. You took suppose we had on the standardized tests questions about how healthy we are, that we die younger than people in 40, 50 other countries. Then they'd have to teach to that. I brought these ideas that I'm talking about to you down as low as grade 5. I had a COPHP student who developed a grade 6 curriculum on these ideas and pilot tested it in the Seattle Girls School over a month, 2 back-to-back sessions a day. And I went there to every session. And, you know, you could really get these ideas across to young people. So we need to start with youth. You know, if we can get young people to recognize these things, it'll make a big difference. So let me tell you a story. So, you know, as people were teaching to the test, I could no longer go to a public school because, you know, they're only teaching to the test, and what I talked about wasn't on the test. So I went to private schools. And one school I went to was the Evergreen School up in Shoreline. It's a K through 8 school, and it's where Bill and Melinda sent their kids. School had a good reputation. So I was once in a class, a large class, talking about these ideas. I could see everybody was confused. So I stopped and I said, how do you know something is true? Silence. You know how silence is uncomfortable. So you break it because it's so uncomfortable. I stood the silence. Finally, a boy raised his hands and he said, if our parents tell us when we're very young, if our teachers and friends reinforce it, and if we've experienced it, we know it to be true. Early life exposure, validation by people you trust, and then experience. The hard part with what I'm talking about is experience. That is, how do you know that the death data are accurate? Actually, you won't find anybody who says they're, the one thing they can be inaccurate about is cause of death. But the fact that somebody's dead is, but you have to believe that those data exist and that they're logged together. And all rich countries collect these data, and poorer countries have very good estimates. What was your question? Oh yeah, Stephen Wolf.
Yeah.
Um,
My question was about, what should students be studying right now to really understand the dismantling of public health policy in this country and infrastructure?
Well, I think public health courses should take public health courses, and those courses should talk about these things. My sort of pet peeve is in our school, there are hardly any courses that talk about these ideas. And if they do, it's kind of a casual mention. I went to Johns Hopkins in 1992 to get an MPH, and what I learned there was political and social things matter most. But, and then a former student of mine went to Hopkins and graduated a year or two ago, and she said, same thing there is here. They don't talk about our poor health status. So we need to teach. I mean, and so we need to provide the material that students have access to. And, that's what I try and do, and I would encourage others.
So speaking of material, the book is great. And one of the things I love about it is it's not just doom and gloom. It's actually, you leave it pretty empowered because you give a very specific set of recommendations. One of the most hilarious, but perhaps useful of which is your killer facts. So you have a list of one-liners that you suggest we employ out in public. My favorite is, Americans have a right to life, but it is only a short one. I want to know, what is your fave one-liner? And then can you teach us how to use these at cocktail parties?
So as we go from the erection to the resurrection, it's the first 1,000 days after conception that really matters for your health. So I see people smiling, what did he say? I mean, so you want to entertain. I mean, we all want to be entertained, and you want to make, a good story makes people laugh, it makes them cry, and it makes them think. And so a good story has those elements, and so tell stories. Sometimes I've been in a restaurant and, you can't shut me up and I start talking. And somebody in another booth will come over and say, hey, if you were running for president, I'd vote for you. Right. My wife shakes her head. She agrees.
Mhm.
It doesn't happen all the time, but so I think that's a good one-liner.
So this is like the elevator speech, except it's your killer fact that you will employ out in public. Your good storytelling to engage people.
So something else that's really important that Taylor Molly says, changing your mind is one of the best ways of discovering whether you still have one or not. I'm always looking for ideas that don't fit the paradigm. And then I've got to address them. Is this really true or not? And I've had to change my mind many times on this. I mean, working as an emergency doctor, I used to harangue my smokers since they were there for all sorts of problems that I was trying to deal with. And once I realized Japan smoked the most, I had to stop that. I had to, and here's something else. You all have opportunities to talk about these ideas with various people. And so I think I outlined some in the book. You're sitting at a bus stop and there's somebody sitting there with you, strike up a conversation. Public places, you can do that. Family dinners. My wife always wants to shut me up. but but develop ways that really work for you to present these ideas, make them laugh, make them cry, make them think. I think it's a skill. It's a skill we should be teaching. How to communicate ideas in the to the public realm.
Here's my hard-hitting question. Are you a Bruce Springsteen fan?
I went to see Bruce in the Tacoma, whatever it's called, stadium there years ago. Yes.
Okay, there you go. Born sick in the USA.
Question from the chat.
Yep. Do you want
The
that?
recognition of financial investment in health outcomes is well studied. Is there any data on how the social aspects of wellness and ways of being that are embraced by ancient cultures translate into outcomes?
That's a very good question. What did we do in our earliest period of existence? For 95% of our existence on the planet, we were hunter-gatherers, forager-hunters. We lived in small groups, 40, 50. Men went off for a hunt every couple of weeks. Studies with existing forager-hunters show that the game from a hunt is shared by everybody, and if anybody gets a smaller share, it's the hunter. And the same thing with foraging. Foraging takes a few hours a day. So you have a lot of, it was the original leisure time society, and so we had a lot of time to be with each other, and I don't think there was much loneliness back then. Because of our devices, our fast-paced society, the stress I've talked about, loneliness is a huge epidemic in this country for which we're not doing much. Same in the United Kingdom, but they've created a minister of loneliness. So countries can have different responses to this. How are we gonna deal with this? Well, in my course, there were several students this year who had to be hospitalized for mental health issues. They were women, and women are the most vulnerable in the early years to the inequalities and the bullying and whatnot shared by social media. Australia has banned social media among the young. They're still trying to figure out how to operationalize that. Jonathan Haidt, in his book, The Anxious Generation, is similarly, it's been on the New York Times bestseller list for about a year and a half. You know, he preaches not exposing young people to devices. Please.
So, touching your pet peeve for a second. Anybody that's been in a faculty meeting, I've heard you say you don't teach it. Please sit down with me and go over some of my courses so that I can show you how we're teaching it and you can show me how to do it better.
I'd be delighted to.
Okay.
Thank you.
Oh, sorry, Peter.
Yeah, our legislature just passed that millionaire's tax, which I think goes at some of the problems you talk about. And I'm wondering if you went and testified before the committees that did that. And if you did, I'd love to hear what questions they asked you. And if you didn't go down there, why not?
He's put me on the spot. In addition to drooling and being confused, I'm pretty lame. So I didn't go down because I thought it was tough for me to do that. However, I have realized you can do online testimony, and so that's what I'm gearing up to do in the future.
Going to answer for him because he educated WPSR members in that committee, and there were 30 from WPSR down there, like stomping around. Huge.
And they were tested.
Absolutely. Well, no, this was not a testimony. This was boots on the ground day. Go meet, talk with every legislator's personal thing.
So Stephen commented that the Washington Physician for Social Responsibility did in fact testify, about 30 people deep. I have one question from the chat, which is that in the 2013 Institute of Medicine report, Shorter Lives, Poor Health by Stephen Wolf, he encouraged learning from other countries that have longer, healthier lives. How best would you recommend those here for the talk today to do that?
Well, teach in grade school. I mean, that's really where the opportunity lies. When you took an SAT, you leave high school, put questions on there about our health status. When you apply to graduate school for GRE, I mean, there are never questions about like that on these tests. Put them there. The CEF criteria for accrediting schools of public health. In the most recent criteria before 2026, you only had to compare U.S. health within itself and not with other countries. I lobbied them to try and include other countries. I haven't seen that on the most recent CEF requirements. The USMLE, the exams that medical students take, they should have these questions on them. We should recognize that, we push up daisies too soon and keep the undertakers in business.
Questions from this side of the room?
James over here. Oh, okay.
Yep.
Hi, Julia, second year MD student. Thank you so much for the talk. One question I have for you is, you showed us that map of the US with some states having a 20-year greater life expectancy than other states. And a lot of the policy recommendations you had were very much at the national level. I was wondering what you would encourage states that have that most, like have the hardest barriers, and have the shorter lifespan. What can those states start working towards as kind of like if the federal, isn't doing anything, what at the state level can be done for some of those most impacted states?
Well, to begin with, if United States as a country was to become healthier, by the way, the American Public Health Association in 2015 launched a campaign, Healthiest Nation in One Generation. It's not there anymore. They took it down because, we were doing so poorly. I mean, now they call it, there's something up there called Generation Public Health, much less meaning than the healthiest nation in one generation. I think the policies the country would have to put in place to become, say, somewhere in the top 20 would require such tremendous change within this country that it would deal with a lot of those poorest counties improving considerably. There's a real problem there, though, in that we do not even, American Indians and Alaska Natives, their data are aggregated, and you can't disaggregate them to take the American Indians as a separate population from the Alaska Natives. The Natives are healthier than the Indians, so it looks better when we aggregate them. So more transparency in the data would be good, and we have the most poverty of all nations, of all rich nations, and the most child poverty, and that's a policy choice. And if so what would you do to do something about our policy? Well, first of all, you've got to know where we are. Most Americans, well, my son-in-law is he joined a federally qualified healthcare center, and the patients are all poor and the staff is all poor. And he gave them Christmas presents, and he later realized they wanted money instead of the Christmas presents. If you're poor, how do you treat poverty? Money. When I was a kid growing up in Toronto, Canada, every month my parents got a check from the government. It was a baby bonus or whatever you want to call it. The same check was given to the parents of the wealthiest in Canada. The system still exists, but it's means tested now. We could have an asset management account to give to have a guaranteed income or an asset management account. There are many different ways in which we could address the poverty issue, but it's understanding that it's a policy choice. Yeah, Robert Reich was who really helped me realize that.
Thank you.
Former Secretary of Labor.
Thank you. Great to see you, Stephen. Just wanted to use this opportunity as a plug, and I'm not sure you did this earlier in the talk, for the UW chapter of the WPSR. Did he already make that plug?
Mhm.
And I don't know if he mentioned, I'm sorry, he had to come late, but we're trying to bring Sean Scott here, who is our state representative, who is the sponsor of Well Washington Fund. So to speak to Peter's question about how do we do this, I think WPSR is doing this grassroots work, and so we're going to be trying to educate people here about getting the funding, taxing the wealthy, to make all this possible. So we encourage you to join us. And Anya Lewin is one of the co-founders of the UW chapter, has now moved to WPSR, and so we got people in the audience. It's very exciting, big group that's developing. So please join us in this struggle. Thank you.
I just want to amplify one thing. Do not be confused by the name Washington Physicians. It's many P's, any person. The organization really thrives because of the non-physicians. We use the opportunity to put on a white coat, maybe get somebody's attention until they realize we're part of the system that's really screwed. But please know that. But since I've got it, I'm going to take this opportunity, in fact, to ask Stephen a question in that area. You let healthcare off because you say it doesn't help. But what about addressing the harm it does? In terms of the consumption of resources, in terms of the misdiagnosis, in terms of the mistreatment that in fact not only sets people up to be poor, but then really puts icing on that unfortunate cake.
So there's a variety of places that are difficult to go to. And one is to tell people that medical care is one of the leading causes of death. Marty McCary, who's now the FDA commissioner, wrote a paper in that in 2017, how healthcare was the third leading cause of death in this country. That's not a comfortable idea. So how do you address that? You know, and similarly, the World Health Organization has a huge amount of material on patient safety. You know, we've sanitized the term medical harm to patient safety. It sounds a little less threatening. But, you know, as a doctor, I'll admit I've killed patients. I didn't go to jail. You know, it's part of what you do as a doctor is you help some and you harm some. And recognizing that is a tough concept to do. I mean, we should have universal health care, single payer, no insurance companies for profit, and spend half of what we do. And I think we could have better health outcomes because of that. Studies on the impact of healthcare in the United States on mortality shows it impacts about 10%. The other 90%, all the stuff upstream.
Dr. Bezruchka, that was perfect timing. It's 4 o'clock. Thank you so much for being with us. And thank you to this lovely audience and for so many students for coming and for all of the people who joined online. We super appreciate that you registered and showed interest and showed up. And I think we've got the room for a little while, so folks are welcome to stick around.